Human immunodeficiency virus, or HIV, is a virus that attacks the body's immune system. It weakens the body's defenses, making it susceptible to infections and diseases. HIV is a lentivirus, a subtype of retrovirus. This means it replicates by inserting its genetic material into the DNA of the host cell. Scientists believe that HIV originated from a simian immunodeficiency virus, SIV, found in chimpanzees. The virus is believed to have jumped from chimpanzees to humans in the early 20th century. This likely occurred through the hunting and consumption of bushmeat in Central Africa. The exact circumstances of the transmission remain uncertain. However, the leading theory suggests that contact with infected blood during hunting or butchering facilitated the species jump. Once the virus crossed into humans, it began to spread slowly and silently, undetected for decades. The virus's ability to remain dormant for an extended period, known as the latency period, contributed to its initial stealthy spread. During this period, individuals infected with HIV may not exhibit any symptoms. This allowed the virus to silently transmit to others, unknowingly setting the stage for a future epidemic. The earliest known case of HIV in a human dates back to 1959. A blood sample collected from a man in Kinshasa, the Democratic Republic of Congo, tested positive for HIV antibodies. This discovery, made retrospectively, provided a crucial piece in the puzzle of tracing the virus's historical timeline. At the time, however, the significance of this finding remained unknown. The tools to identify and understand the virus did not yet exist. The 1959 sample lay dormant in a laboratory, a silent sentinel of the impending epidemic. Other isolated cases likely occurred in the ensuing decades, but they went largely unrecognized. Without the ability to test for HIV, these cases were often misdiagnosed or attributed to other illnesses. The virus continued its silent spread, masked by its own elusive nature. These early cases highlight the challenges in identifying and containing emerging infectious diseases. They emphasize the importance of robust surveillance systems, diagnostic tools, and scientific collaboration to detect and respond to public health threats effectively. In the early 1980s, a mysterious new illness began to emerge, primarily among gay men in the United States. This illness was initially met with confusion and fear, as it seemed to strike without warning, leaving communities devastated and healthcare professionals scrambling for answers. This illness, initially dubbed gay-related immune deficiency, or GRID, was characterized by severe immune deficiency, leaving individuals vulnerable to opportunistic infections and cancers. Patients experienced a rapid decline in health, often succumbing to rare infections and diseases that their bodies could no longer fight off. As cases mounted, it became clear that the illness was not limited to gay men. The medical community began to see a broader pattern, with cases appearing in other populations. Intravenous drug users, hemophiliacs receiving blood transfusions, and individuals from different geographical locations were also affected, suggesting a blood-borne pathogen as the culprit. This realization expanded the scope of the epidemic, highlighting the need for a more comprehensive public health response. In 1982, the illness was officially named Acquired Immune Deficiency Syndrome, or AIDS. This new terminology helped to destigmatize the disease, shifting the focus from a specific group to a broader public health crisis. This marked a turning point in the epidemic, bringing it to the forefront of public attention and galvanizing scientific efforts to uncover its cause. Public health campaigns began to emerge, aiming to educate the public and reduce the spread of the disease. The discovery of the human immunodeficiency virus, or HIV, in 1983 and 1984 by two independent research teams, one led by Dr. Luc Montagnier at the Pasteur Institute in France, and the other by Dr. Robert Gallo at the National Institutes of Health in the United States, was a pivotal moment in the fight against AIDS. This discovery confirmed that HIV was the causative agent of AIDS, providing a clear target for medical research. It provided a critical breakthrough in understanding the disease and paved the way for the development of diagnostic tests and treatments. The identification of HIV allowed scientists to develop blood tests to detect the virus, which became essential tools in screening blood supplies and diagnosing patients. Early research into treatments began, setting the stage for future medical advancements that would transform the lives of those living with HIV/AIDS. First light in the darkness. Early testing and treatment. The identification of HIV as the causative agent of AIDS opened the door for the development of diagnostic tests. This was a monumental step in the fight against the epidemic, as it provided a clear target for scientists and medical professionals to focus their efforts on. In 1985, the first HIV antibody test was approved by the US Food and Drug Administration, allowing for the detection of the virus in blood samples. This test was a game changer, as it enabled widespread screening and early detection, which are crucial in managing any infectious disease. This breakthrough was crucial for several reasons. It not only provided a means to identify those infected, but also helped in understanding the spread of the virus, thereby aiding in the development of public health strategies. Firstly, it allowed individuals to know their HIV status, enabling them to make informed decisions about their health and prevent further transmission. This knowledge empowered people to take control of their health and seek medical advice and support. Secondly, it provided healthcare professionals with a tool to diagnose HIV infection earlier, leading to more timely medical intervention. Early diagnosis is key in managing HIV, as it allows for the initiation of treatment before the virus can cause significant damage to the immune system. In 1987, the FDA approved the first antiretroviral drug, azidothymidine, or AZT, for the treatment of HIV/AIDS. This approval marked a significant milestone in the history of HIV treatment, offering a new avenue for managing the disease. While AZT was not a cure, it represented a significant step forward in managing the disease. It was the first drug that showed promise in slowing down the progression of HIV, giving patients and doctors a much-needed tool in the fight against the virus. It offered a glimmer of hope in what had been a bleak landscape. For many, it was the first sign that the medical community was making progress in understanding and combating HIV/AIDS. AZT worked by inhibiting the reverse transcriptase enzyme, which HIV uses to replicate within human cells. This mechanism of action was a breakthrough in itself, as it provided a new target for future drug development. Although AZT had significant side effects and only limited effectiveness when used alone, it marked the beginning of antiretroviral therapy, a cornerstone of HIV treatment today. The development of AZT paved the way for the creation of more effective and less toxic antiretroviral drugs, which have transformed HIV from a fatal disease into a manageable chronic condition. A global shadow HIV's impact widens. During the 1990s, the HIV/AIDS epidemic continued to spread globally, reaching all corners of the world. The virus did not discriminate, affecting people from all walks of life, regardless of age, gender, or socio-economic status. It became a universal threat, challenging healthcare systems and societies worldwide. The epicenter of the pandemic shifted to sub-Saharan Africa, where limited access to healthcare, poverty, and social inequalities fueled the virus's transmission. In these regions, the lack of medical infrastructure and resources made it difficult to combat the spread effectively. Communities were left vulnerable, and the virus spread rapidly. In many African countries, HIV/AIDS decimated populations, orphaned children, and devastated economies. The loss of a generation of adults had a profound impact on the social and economic fabric of these nations. Families were torn apart, and the future of entire communities was put at risk. The social stigma surrounding the disease often prevented people from seeking testing and treatment, further accelerating its spread. Fear and misinformation led to discrimination, and many individuals suffered in silence, afraid to reach out for help. This stigma created a barrier to effective intervention and support. The international community began to recognize the urgent need for a coordinated global response to address the growing crisis. Governments, NGOs, and health organizations came together to strategize and implement measures to combat the epidemic. This collaboration marked a significant step towards a unified fight against HIV/AIDS. The World Health Organization established the Global Programme on AIDS in 1987 to coordinate international efforts. This program aimed to provide guidance, resources and support to countries battling the epidemic, fostering a sense of global solidarity and shared responsibility. And in 1996, the joint United Nations Programme on HIV/AIDS, or UNAIDS, was created to lead the global fight against the epidemic. UNAIDS played a crucial role in mobilizing resources, advocating for policy changes and supporting research and development of treatments. The 1990s were a grim chapter in the history of HIV/AIDS. Hospitals and clinics were overwhelmed with patients, and the medical community faced unprecedented challenges. The human toll was immense, and the emotional and psychological impact on those affected was profound. The world grappled with the scale of the epidemic and the devastating impact it had on individuals, families and communities. The loss of loved ones, the fear of infection and the economic strain created a pervasive sense of despair. Yet, amidst the darkness, there were glimmers of hope and resilience. However, it also marked a period of increasing global awareness and mobilization, laying the groundwork for future progress in prevention, treatment and care. Awareness campaigns, educational programs and community outreach efforts began to take root, fostering a more informed and proactive approach to combating HIV/AIDS. The foundation was set for a more hopeful future.